So hi, I'm Sahand from TU Munich. Actually, before me, Corbinian was supposed to be giving a talk. He couldn't come, so he made sure I use best use of his 5 minutes extra, but don't worry. So I'm going to talk about brain surgery. Just don't care about the topic, it's pretty long, and just explain it to you. So imagine that we want to do a brain surgery, and we have a patient who has a tumor. And specifically, we want to do it in the future with a robot, and it has to be pretty precise. The thing is, to locate the tumor and know where to enter the skull and remove the tumor, we need to take MRI images prior to the surgery. And so we take the MRI images, something like that, and we see, okay, the tumor is there, and then we say, okay, I'm going to enter the skull from there. However, once the surgeon opens the skull during the surgery, a problem happens. The problem is that the pressure in the brain changes, and it causes the brain liquor to go out, and this causes the brain to move. This moving is called brain shift. It's a very known problem, and you can see here the brain shift effect. It's not much, it's only up to 2 millimeters, but it's very effective because the robot wants to take out the tumor. So what do we do? What we can do is to take another MRI image, but the skull is open and it's in the surgery room. It's not really convenient and it's very expensive to do that again. We can use another imaging technique, which is known as ultrasound. You may know it. The ultrasound has another problem. It has a very limited field of view, and it has some artifacts. However, it's good to take it during the surgery. What we can do is to take the ultrasound image and take the MRI image, look at the ultrasound and look at the MRI and say, okay, I can see somehow that the brain has moved like this from the prior to the surgery to after that. And then I know how the movement has been done. And I will apply this movement to the MRI image, and I will update my MRI image, and I will have an updated MRI image. We can do that by a fusion, which in computer vision is called image registration. So in image registration, we have a source image, MRI. We have a target, assume that is ultrasound, it's not. And we want to find the corresponding pixel for every pixel in the first image to the second image. So we take every pixel, go into the second image, and search over it and say, okay, which one is the most similar pixel to my pixel in the second image? And then we find it. So this can be written as a similarity measure between the ultrasound and MRI image. And the T of X is our transformation matrix. And we do it over the whole image, all the pixels. So we can define a functional or energy function in physics as an integral over all of them. We can input more prior into this problem. As many priors, as many previous knowledge that we have about this problem improves our registration. For example, we know that this pixel goes there, the neighbor doesn't go somewhere else. Like that. It does not do that because the neighboring pixels go to the same place. We can incorporate that into our functional by also adding the gradient, but the norm of the gradient of the transformation matrix. So once we try to optimize the E of t, we also minimize that. So we try to have a T of X which has the least gradient. I will explain my poster in more details if you're interested. So what did I do? I'll go back. You see there are lots of pixels. It's a lot of computation. If you want to do the surgery, during the surgery, it's a lot of computations. We can reduce the computation time by reducing the dimensionality. And we would do that by choosing specific points and incorporating the whole cost function of the previous slides into only these points. And then we have much less computation. What I did was to choose these control points, but to enable us to be able to choose these control points in a very more plausible, in a much more plausible way. Before it was another way. Again, you can refer to my poster. But now we can just put them wherever. And what does it give us? It enables us to enter another prior into the problem. And that is, for example, we know that the skull points do not move much into the brain shift effect. Like these guys do not really move much. So basically, we also include that prior into our problem and get a better registration. So here you see the results. These are just synthetic data to test the approach on. This is the source image, and that's the target image. This is the work done previously. They're registered, as you can see here. It's a very bad registration, or for example, there. And that's what I did, which improved the registration up to a point, which is very important in this problem. And you can refer to my poster to see how I did that exactly. Thank you.